afternoon. This is Dr. Subhash from Pune. Today I'm going to talk about acne and its management. Acne, basically, it's a very chronic inflammatory skin condition affecting the pilosebaceous unit of the skin and is characterized by special lesions like comedones, papules, pustules, nodules, and sometimes scars. It is a very common skin condition which are experienced by people of all ages. And the basic event that triggers the development of acne is blocking of the skin pore by oily substance called as sebum, some bacterial infections, and skin dead cells. Regarding it is very common condition. It affects mostly the 80% of the population in the age group of 11 to 30 years, and they in their entire life sometimes develop some form of acne. The most common age group that are affected are the teenagers as well as the young adults who are undergoing hormonal changes. However, it may affect people in the age group of 20s, even late 30s. Some people do experience it during even adulthood. The body parts where the acne are lesions are found are the face, which is the most common site, including the forehead. It also involves the upper back, chest, as well as shoulders. There are different forms of acne which a people can manifest, like it could be blackhead, whitehead, papules, pustules, nodules, and sometimes even fungal infections like fungal spores can be there. The basic event or the causes that leads to acne is the hormone, as I earlier said, that it is most common in teenagers and young adults who are undergoing hormonal changes. So basically, testosterone, which starts secreting during the teenage group, leads to production of excess sebum, and this excess sebum gets infected by the Propionibacterium acne, which are found mostly on the skin, that degrade the fatty acids present in the sebum, leading to blockage of the skin pore and ultimately development of acne. Regarding the pathogenesis, this is or not all. There are various factors that also aggravate or worsen this acne, like the fluctuating hormonal levels, which happens either during the puberty or during the time of periods which among women or female patients have. Even some patients has a habit of picking the acne that can again aggravate the acne development, and clothing as well as the headgear and oily substance that we use in our personal care products do aggravate these acne. Even some medications are known to worsen acne manifestations. Besides, there are few myths which happens regarding the acne, like is it chocolates or sugar product that eating chocolates or greasy food has little or no effect on acne. Even dirt skin does not always cause acne. There are few cosmetics that do trigger acne, but oil-free cosmetics necessarily does not worsen acne. Based on the severity of acne, acne can be graded into various grades, like grade 1, which are mild, and mostly they are whiteheads with a few papules and maybe some pustules. Whereas grade 2 acne, they are moderate acne or pustular acne, which manifests with some papules as well as some pustules, mostly on the face. Whereas grade 3 acne are moderately severe and it includes pustules, some lesions may be nodulocystic, and grade 4, which are nodulocystic and which contains numerous large, painful, or it could also contain inflamed pustules as well as nodules. Depending on the severity, acne treatment can be either topical management or systemic management, or there are other therapy modalities are there. Like grade 1 or grade 2 acne can be managed with only topical preparations, whereas grade 3 and grade 4 mostly require a systemic treatment. In topical, the medications that we normally use is benzoyl peroxide, which is available over the counter, and normally it kills the bacteria, and mostly also it has some antibacterial as well as antistatic effect. The other is the salicylic acid product, which is again over the counter. It is available. It mostly dissolves the salicylic, the skin, the dead cells of the skin, and which leads to The follicles which are clogged, they open up. Other topical medications which are available is azelaic acid that kills the microorganisms on the skin, as well as it reduces the inflammation. It also has some skin lightening properties. Retinoids, they again are various types of retinoids, ranging from adapalene to tretinoin, which are mostly vitamin A derivatives. They prevent the clogging of the skin by breaking the different blackheads or the whiteheads. And the limitation of this treatment is only the irritation part, which is most commonly faced by the people. Regarding the systemic treatment, yes, antibiotics are there, which mostly includes doxycycline, minocycline, azithromycin. Even these days, levofloxacin and other antibiotics are also used. They normally kill the microorganism like Propionibacterium acne that aggravate the acne. Besides antibiotics, there are other drugs like hormonal drugs, which are oral contraceptives. They are mostly useful in those patients which are having hormonal acne or the acne which manifests mostly during the period times. Isotretinoin is a drug that works on all the stages of acne, and it is basically indicated for grade 3 or grade 4 acne. Mostly, it acts on all the pathways of development of acne. Besides the medications, there are different modalities which we use along with this conventional acne treatment, like steroids. We do prescribe steroids for grade 3 or grade 4 acne or the inflammatory acne. Either it is in systemic form or even sometimes it is injected into the lesion. Lasers, these days, lasers and IPL, they do work on acne on all stages, mostly the inflammatory as well as except the comedone part, everywhere it acts. The complications of acne, like the acne scars, they are further managed with the use of lasers. The chemical pills, these are the treatment modalities which helps in not only in reducing the acne, but it also helps to treat the complications of acne like the hyperpigmentation. So when we're talking about the complications of acne, uh, normally of acne is self-limiting, but when it does come with some complications like a scars, which could be either a pitted scar, it could be atrophic scar, or it could be a hypertrophic scar. Then there may be some skin changes, which could be either a hypopigmentation as well as hyperpigmentation. The acne people do get during the teenage, but there are several factors which causes the aggravation of acne, and these factors are mostly the age itself, like the puberty, then the hormonal changes, sometimes the oily product that we use, and even the friction or pressure or the clothing or headgear that we use again causes this acne. So if we try to conclude, it is acne is a common skin problem that happens in teenage and young adults, mostly who are undergoing hormonal changes. There are different forms of acne, which ranges from blackhead to whitehead. It could be papule, it could be pustule, it could be nodule, or it could be even fungal acne. Both both our conditions are treated very well with topical as well as systemic medications, and even the complications, if it is treated well on time, the chances or the prevalence is very low. Thank you very much.